Hello, thank you for joining us. We hope that you enjoy all that you will learn about ASAP during this presentation. We will begin with a short video. ASAP's Board of Directors is comprised of patients, doctors, and other persons affected by Chiari malformation or Syringomyelia and is all volunteer. ASAP's Medical Advisory Board is made up of doctors and researchers prominent in this field of study. Also volunteer, we are deeply grateful for their dedication to ASAP's mission. Meet our founders, Barbara and Don White. Barbara was diagnosed with Syringomyelia in 1983. Information was very limited at that time, and after undergoing multiple surgeries with little success, they began their search for answers. Meet our founders, Barbara and Don White. Barbara was diagnosed with Syringomyelia in 1983. Information was very limited at that time, and after undergoing multiple surgeries with little success, they began their search for answers. Due to frustration experienced while trying to find proper medical care and understanding, ASAP was founded. The Whites searched around the world for knowledgeable physicians or support groups that could help them. With the help of family, friends, and their local state representative in Texas, they took a leap of faith and began the paperwork to make ASAP a reality. They developed their bylaws, filed for incorporation, and received the 501c3 nonprofit status from the Internal Revenue Service, denoting them as a bona fide nonprofit organization. The Whites were desperate for a knowledgeable physician to treat Barbara when they learned about Dr. Bernard Williams' work with Syringomyelia. Dr. Williams introduced the Whites to Anne Conroy, a patient who started ANTS, a support group based in England. ANTS was founded in 1980. The name was later changed to the Anne Conroy Trust in her memory. After Barbara's death, Don made several trips to the UK to attend meetings of the Trust, as well as the International Symposium Syringomyelia 2007 held in Rugby. Dr. Williams played a major role in ASAP. He recorded video presentations used for education and spoke at several ASAP conferences. Incorporated under the name American Syringomyelia Alliance Project, Barbara White and Candace Morse coined the acronym ASAP. This acronym ASAP seemed apropos as it is also a common acronym for as soon as possible, signifying the urgency of our mission. Since the original name did not fully represent the scope of information provided, the name was changed to American Syringomyelia and Chiari Alliance Project in early 2000. The ASAP logo was designed by founders Barbara White and created by Don White in 1988. The emblem represents both her home state and her diagnosis. The center star represents the state of Texas where the Whites resided and also where the organization began. The innermost design embodies the brain, spine, and nervous system, representing Chiari malformation, Syringomyelia, and the neurological damage associated with both. The circles represent a coming together, a unity of people from around the world to find answers. ASAP's goals are to identify and provide support to people with Syringomyelia, Chiari malformation, and related disorders, to improve awareness of healthcare providers, to educate healthcare professionals specializing in SM and CM, to coordinate the efforts of organizations working for improvement in the lives of people with SM and CM, to initiate and further research efforts to find causes, develop new treatments, and improve existing treatments, to provide a clearinghouse for information, and to increase public awareness about the debilitating effects of these disorders. ASAP has sponsored multiple fellowships for neurosurgical residents to conduct research or receive special training particular to Syringomyelia and/or Chiari malformation. These fellowships provide a unique opportunity to encourage upcoming neurosurgeons to explore the complex issues surrounding these disorders. ASAP has used multiple surveys to determine areas of interest. ASAP members lobbied the Congress in 1993 to pass legislation which resulted in the National Institutes of Health conducting a conference to set Syringomyelia research agenda. ASAP has committed well over $1 million to fund these research projects over the years. On this slide, you will see a sampling of the types of research funded by ASAP. It includes a broad range of disciplines representing the many different aspects of syringomyelia, Chiari malformation, and related disorders. Please take a moment to peruse these efforts. The lack of knowledge of these disorders led to education being identified as a critical factor in ASAP's mission. Beginning modestly in Colorado in 1989, the ASAP Annual Conference brings together patients and professionals. This includes neurologists, neurosurgeons, researchers, patients, and caregivers. The location is determined each year by the home state of our hosting physician. Over the years, our conference has been held in 26 cities, some twice, in 19 different states. In this way, our conference is available to the greatest number of people interested in attending. This is a small sampling of photos depicting the different aspects of ASAP's annual conference: banquet dinner, support groups, social events, awards, scientific presentations, and demonstrations, all combine to make this an amazing and powerful event. Another important aspect of ASAP is providing support and increasing awareness. From telephone support to local support groups, social media, message boards, and chat rooms, we try to offer a broad range of support. Here are just a few photos demonstrating the importance of support and how common bonds can form lasting friendships. Through personal outreach, Barbara grew the organization. Her willingness to share her feelings openly helped many others come to terms with their SM. Barbara passed away in 1991, but her legacy continues. ASAP Connections, our newsletter, is now sent out to over 10,000 members. From a news story in 1988, Barbara discovered the Bobby Jones Open, an annual golf tournament held to raise money for syringomyelia research. The Whites attended the event in Ann Arbor, Michigan. For the small group of people present with SM, it was the first time most had met another person with the disorder. Then Barbara wrote, "I truly believe that when one person with syringomyelia meets another, that becomes a friendship that will never be broken." Awareness events are a great way for members to get involved and help raise money for programs and research. The Walkathon is a popular event to help raise awareness and support ASAP programs and research. Over the years, members have held walks all across the United States. Additionally, ASAP volunteers have held balls, dinners, ride-a-thons, held Coins for a Cure events, bowl-a-thons, community fun days, and others. Here is a small sampling of photos from some of our different events. They are designed to raise funds for research and bring people together in support of our cause. Here you will see some of our different awareness efforts. T-shirts designed by members, designating May, the month we were founded, as Syringomyelia Awareness Month, and September as Chiari Awareness Month. This effort includes lobbying state and local governments for these recognitions. Another important aspect of ASAP is the Kids for a Cure Club. Open to those 16 and under, this effort supports our younger members. Cards, care packages, and our kids program at the annual conference offers support to those who need it most. Always seeking new ways to have a more important impact on our community, ASAP has broadened our horizons. Recognizing the need for something more far-reaching, ASAP held its first international conference in 2017. Countries represented included France, Spain, Italy, Australia, England, Germany, China, and Japan. The result was a commitment from all involved to form a truly international organization specifically to benefit the CMSM community. The goals of this international group are as follows: assisting and supporting patients, families, and caregivers of all those affected by syringomyelia, Chiari malformation, and related disorders. Providing education to patients, families, and caregivers, including doctors and healthcare professionals. Sponsoring basic, clinical, and genetic research in the field. Organizing and sponsoring national and international meetings. And raising funds through public and private entities. If your group would like to be a part of this exciting new initiative, please contact us at info@asap.org. From the founders of this international collaboration and ASAP, thank you.